Good afternoon. On behalf of the Natrona County Emergency Operations Center, thank you for joining us for today's COVID-19 response news brief. For those joining us online through Casper-Natrona County Health Department's Facebook page or the City of Casper YouTube channel, we will be copying all prepared statements from today's brief into the post following today's broadcast. We also encourage you to submit any questions or concerns you have in the comment section. We will do our best to either answer your questions on air or we will reply to your comment as soon as we can following the broadcast. Yesterday, Governor Gordon held a press conference and released additional information regarding COVID-19 restrictions for the state. You can read full copies of the orders on our website at natrona.info. As a quick overview, the new extensions to the pre-existing state orders keep all of the current restrictions in place while allowing some businesses to open in a limited capacity, such as fitness facilities, salons, massage and tattoo parlors, and barbershops. The orders also allow daycares to accept children of non-essential workers and restaurants to offer carry-out services. In every single one of these ease of restriction situations, very specific social distancing face covering and other guidelines apply to ensure both workers and customers are limiting the spread of disease. The orders also close schools through May 18th and continue to limit gatherings of 10 or more people. We highly recommend that everyone read through these orders for the full details. Those can again be found on our website, natrona.info. The extension of orders announced yesterday have an end date of May 15th. At this time, it is unclear as to whether the orders will be extended or if authority will be delegated to the counties to make further decisions. As we wait for further guidance from the state, we are working hard to be ready for whatever decision is made. Your local team here in the Natrona County Emergency Operations Center has been diligently working in collaboration with emergency response experts, the Natrona County health officers, and local elected leaders to formulate a slow and safe opening plan should one need to be enacted at the local level. A couple weeks ago, Mayor Friel asked for your recommendations on how to safely reopen our community. With those comments and analyzing plans from around the country, we are working to create a safe plan that works for us here in Natrona County. The details of that local plan are still being discussed, but we want to assure you that any decision made is one that is data-driven and based on the recommendation of health experts. As the governor stated yesterday, we have to get this right, and a huge part of safely reopening is the buy-in and participation of every single one of us living in Natrona County. The governor announced that he will be holding press conferences today, tomorrow, and Friday at 3 p.m. to further discuss the state's reopening plan. With the rest of our community, we are eagerly anticipating what that guidance may be and are ready to respond at the local level if we need to. We encourage everyone to watch these conferences on Wyoming PBS. They can also be viewed on the Wyoming PBS Facebook and YouTube pages. For today's news brief, we will be hearing from the Natrona County School District, Wyoming Medical Center, and Casper-Natrona County Health Department. Thank you.
Good afternoon. My name is Tonya Sutherland, Public Relations Officer for the Natrona County School District. At this time, I would like to share updates regarding NCSD operations. During their April 27th meeting, the Board of Trustees approved a recommendation for schools to remain closed while continuing the virtual remote learning environment for the remainder of the 2019-2020 school year, with the exception that the district explores the opportunity for small in-group learning following Casper-Natrona County Health Department guidelines. More information will be forthcoming regarding any potential small group in-person learning exceptions after working together with the Casper-Natrona County Health Department and within the required Wyoming Department Education guidelines. An in-depth and sincere conversation was held regarding the 2020 high school graduation ceremonies. After discussions with the Casper-Natrona County Health Public Department, a variety of options were presented to trustees for their consideration. Trustees have asked for district officials to work together with high school leadership teams on the design of individual high school graduation ceremonies, and those details will be shared with the Board of Trustees at their upcoming May 11th meeting. Leadership teams will work together with students, parents, and their school families. Graduation ceremonies and plans will be presented for approval to the Casper-Natrona County Health Department. As you are aware, there are projected economic impacts due to COVID-19 and the decline of energy prices and production to our state and country. Our state legislature is working diligently to address these concerns, and we appreciate their servitude during these very challenging times. The Natrona County School District has begun proactive work to continue to do our part in maintaining educational excellence while creating and implementing strategic measures to maintain fiscal responsibility. At the May 4th Board Budget Committee meeting, staff will present a conceptual baseline budget for committee review. The board budget development process continues to be guided by the following priorities. First, to maintain a focus on student learning and the district's strategic goals, funding essential functions and services. Second, achieve operational efficiencies and effectiveness. Third, maintain a competitive compensation package. And fourth, maintain facilities to avoid the effects of deferred maintenance and ensure safe and healthy and secure environments for all. We will continue to update you as we have more information regarding school operations, graduation ceremonies, budget development process, and more. We recognize the profound impact COVID-19 has had on our students, staff members, families, and our community. We have a lot of unknown challenges before us, but we know that by working together through proactive planning, effective operations, compassion, and understanding, we can face any obstacle put before us and rise above together.
Good afternoon. I'm Christie Bligh with Wyoming Medical Center. Amid spread of the novel coronavirus, many people are avoiding hospitals and medical offices, but it's critical to continue to seek medical care and stay in contact with your doctor. Wyoming Medical Center's emergency room is open. Please do not delay treatment for medical emergencies. We have taken extra precautions to protect patients against coronavirus infections, including separate waiting rooms for people with respiratory symptoms. Wyoming Medical Center and other hospitals treat infectious disease every day, and we have protocols to protect patients, staff, and physicians. Please call 911 for symptoms of stroke, heart attack, breathing problems or respiratory distress, serious trauma, head injuries, headaches, or abdominal pain. Medical emergencies have not stopped for the pandemic, and patients who ignore these symptoms will likely have long-lasting effects down the road if they do not seek emergency care right away. People who suspect they have a serious case of COVID-19 with shortness of breath or other severe symptoms can call 911. This alerts staff of the suspected case and allows responders to prepare for your arrival, either by reporting to the ER or arriving by ambulance. please follow medical advice of the dispatchers. Or people can call our respiratory clinic telehealth hotline for COVID-19 symptom questions, to schedule a virtual appointment with a medical provider, or to be referred to another level of care. That number is 307-233-7288, and the hotline is open 8 a.m. to 8 p.m. every day. It is also important to stay in touch with your family's healthcare providers to manage chronic health conditions and medications, talk about new concerns, get your annual wellness exam, and more. All Wyoming Health Medical Group providers are scheduling virtual appointments over your phone, tablet, or computer. Simply call your doctor's office and they will get you started. Wyoming Medical Center appreciates your community spirit and cooperation through this crisis, and we greatly appreciate everyone who has reached out to deliver lunch, make banners for our healthcare workers, sew masks and other personal protective equipment, and send thank you notes through the mail. We are proud to be part of this community with you. Thank you.
Good afternoon. I'm Haley Bloom with the Casper-Natrona County Health Department. As of this morning, across our state, there have been 9,077 tests performed, 396 confirmed positive cases, and 260 of those statewide positives have now recovered. As of this morning, 21 Natrona County residents have also recovered. In total, there have been 1,015 tests performed in Natrona County between the main two testing facilities of Wyoming Medical Center and the Casper-Natrona County Health Department. Of that, 926 were confirmed negative, 39 have been confirmed positive, and we're still pending results of 50 tests. Currently, we still have 39 positive COVID-19 cases in Natrona County. Our last positive was confirmed Wednesday, April 22nd. Right now, it appears as if our community does not have high numbers of confirmed illness. However, it's still absolutely critical to know that without widespread testing, this number is simply not an accurate representation of the amount of COVID-19 in our community. This is why it's so important that we increase the number of tests we are performing within our community, and why we are so excited to finally have the ability to do so. Earlier this week, we announced that we have successfully secured more testing kits to be able to increase widespread testing for COVID-19 in our community. The Wyoming Department of Health Public Health Laboratory and the Natrona County Emergency Operations Center have equipped the Casper-Natrona County Health Department and Wyoming Medical Center with the ability to largely increase their testing. There is substantial evidence showing that individuals may be asymptomatic, meaning they feel completely normal or have minimal to no signs or symptoms, but still be contagious with COVID-19. This is evidence that even though you may feel fine, you could still be infected with COVID-19 and be contagious to others. Our Natrona County health officers believe increased testing for those with minimal signs or symptoms is crucial to gaining the data necessary to begin opening our community. Previously, testing in Natrona County was prioritized for individuals with known COVID-19 symptoms, such as cough, fever, shortness of breath, as well as for those who were older in age, had known underlying health conditions, healthcare workers, and first responders. Now, both testing facilities will be accepting a wider range of individuals to be tested for COVID-19. Instead of limiting testing to those who meet both requirements of being in a priority group and displaying symptoms, testing is now available to anyone displaying known COVID-19 symptoms. Our goal is to continue to increase testing for COVID-19. We hope this additional crucial information will allow us to have the baseline data necessary to better understand the spread of this virus within our community. Community members may be eligible for a COVID-19 test if they're displaying one or more of the following symptoms: fever, cough, shortness of breath or difficulty breathing, chills, muscle pain, headache, sore throat, new loss of taste or smell, or overall flu-like illness. Anyone who has one or more of these symptoms and wishes to get testing needs to call the Casper-Natrona County Health Department hotline at 307-577-9892 or the Wyoming Medical Center Respiratory Screening Clinic at 307-233-0291. Please do not go to either of these locations prior to calling. This protects the safety and well-being of healthcare workers and the entire community. The Casper-Natrona County Hotline is currently operating Monday through Friday from 8 a.m. to 5 p.m. The Wyoming Medical Center Respiratory Screening Clinic is open daily from 8 a.m. to 8 p.m. If you have symptoms, please call those numbers so you can get tested. We cannot realistically gather data to safely reopen without community members with symptoms coming forward to be tested. Now that we have the ability to do widespread testing in Natrona County, it's absolutely crucial that we do that. However, we can only test those who contact us to get tested. So please give us a call and get scheduled. You can find the contact information on our website at natrona.info. Over the last couple of weeks, we've also been making major strides in an effort to use plasma from recovered COVID-19 patients in Natrona County. There is evidence that viral shedding, or the exposure of the virus to others through someone ill, can take place days prior to getting symptoms and even days after feeling better. We have been monitoring all of our Natrona County confirmed positive cases, and many of those have had to be retested for various reasons, including returning to work in healthcare, living with a high-risk family member, or living in a congregate setting. Many of our positive cases that first tested positive and were reported back in early and mid-March are still testing positive for COVID-19 over a month later. This means those patients still had the COVID-19 virus in their nose. Even though they may feel better and may have met criteria by the CDC and Wyoming Department of Health for being recovered, they could still potentially expose others through respiratory droplets like sneezing or coughing. To protect yourselves and others, the widespread use of face coverings in public is crucial. A face covering can be made inexpensively from household items like an old t-shirt, a bandana, or even a scarf. Face coverings should cover your mouth and nose and be worn in places like grocery stores, retail stores, and pharmacies. The governor and state health officer issued continuations and modifications of several of the 3 statewide public health orders. This is a promising step as we begin to slowly resume life with a new normal. It's crucial that we continue to do all we can to avoid the spread of COVID-19. We all play a part to keep it that way, and we encourage everyone to take the following personal actions. Follow current public health orders, which encourage limiting trips out, keeping social distance, wearing face coverings, and increase hygiene. Stay home when you're sick, seek testing for confirmation, and avoid contact with other people as much as possible. Follow common sense steps like washing your hands often and well, covering your coughs and sneezes, and cleaning and disinfecting. This week, we also embarked on a very exciting journey. Nationally, there has been a lot of discussion around using the plasma from those who are COVID-19 positive who have now recovered to treat those who are very ill. The plasma of the recovered positive contains crucial antibodies that can fight back against COVID-19. This week, thanks to some amazing, selfless, recovered COVID-positive community members and the expertise of our local infectious disease physicians, we will be able to provide plasma for the treatment in our sickest COVID-19 patients in the Wyoming Medical Center. At this time, the exact amount of plasma that will be able to be supplied to patients is unknown, but we're making huge strides in providing this potentially life-saving treatment right here in Natrona County. If you need to get in touch with the health department regarding information, events, or questions that are unrelated to COVID-19 symptoms, we encourage you to email us at covid@cnchd.org. We are responding to emails as quickly as we can. Lastly, we would like to thank you for your ongoing efforts to fight this virus in our community. We know many of you are making substantial sacrifices, including financial ones. We know it is becoming more difficult to continue to remain indoors and stay away from family and friends. Please stay the course. The sacrifices you have been making by staying home and social distancing are making a difference. I will now take any questions anyone may have.
Thank you, Haley. Our first question is in regard to antibody testing. Essentially, what is it accurate, and is it available in our community?
So nationally, we're hearing a lot about antibody testing, and our Natrona County health officers have made the decision that at this time we will not be using antibody testing in our community just because those tests have not been FDA validated or approved. A lot of those antibody studies are taking place at a research level, so those are under the direction of a large research institution. So at this time, we will not be using those in our community. However, we're hopeful that in the future we may be able to offer that.
You spoke about the increase in testing. Can you talk about the process of getting that supplies and if we can expect more tests in the near future?
Yeah, so as we've seen across the nation through this whole pandemic, we've struggled to secure the necessary resources that we need, not just for healthcare providers, but also for testing. We had issues securing the viral medium that the test is transported in, and then also the swabs that are used to take the test. Nationally, we've seen an uptick in this production and have been able to thankfully get some more tests. So as we mentioned, we received a large number of tests just this week, and we have the opportunity to get some more in the coming weeks.
Haley, our last question. With people testing positive for COVID-19 over a month after testing positive in March, is there a concern that people can still transmit the virus long after first testing positive?
I think that's a really valid question. So nationally, around the world, we're trying to learn as much about this virus as we can. However, since it's so new, we're learning more and more every day, and oftentimes many things that we've learned, we've later found through more research are different. So we've been following the guidance from the CDC and from the Wyoming Department of Health on what classifies as recovery. In the past, we had limited amounts of tests, so we weren't necessarily testing people after their symptoms had resolved and they had met that criteria. However, with the increase in testing that we have, we're hoping that maybe we could increase that testing in those recovered patients going forward. And I think it's also important to note that we are following up with all of the positives in our community and keeping in touch with them at the health department level. And all of those individuals have been advised and have been taking appropriate precautions, such as wearing a face mask to further avoid transmission to others.
Haley, our last question for you is from Facebook. Linda asks, how quickly does the public receive their test results of a COVID test?
So fortunately, due to that increase in testing, the Wyoming Department of Health Public Health Laboratory is accepting more of those tests and those samples now. They had limited that in the past. So if a test is performed at one of our larger testing facilities of the Wyoming Medical Center Respiratory Clinic or the Health Department, those results are taking anywhere from 1 to 3 days to be returned. As far as private labs, if your doctor sends that to a private lab, those times can fluctuate from a couple of days to a week or more. Thank you. We had a couple other questions we wanted to help address. One comes from the Casper Star Tribune, specifically asking about the enforcement of the continuation of the orders. That's actually a question that was posed yesterday by Casper Star to the governor, and so I'll just reiterate a little bit what he said. You know, essentially these are continuations of the current orders. So the same type of enforcement conversation that we've been having for the last month still applies here. But for the most part, we've seen a lot of our community members and businesses following the orders. Everybody wants to open back up. These businesses are very eager to do the right thing, and they have been doing the right thing from what we've seen, and we believe that they'll continue to do so. So thank you for the question. We appreciate it. We also received some questions on Facebook in regards to camping and dental offices, and we're going to be following up with you guys there in the comment section here momentarily following the press brief. At this time, this concludes today's news brief. Thank you for joining us. And as a reminder, you can watch this full briefing at any time on the City of Casper YouTube channel or Casper Natrona County Public Health Facebook page. You can also view the latest local information on our website, natrona.info. Our next news brief is scheduled for Wednesday, May 6th at 3 p.m. And until then, please keep yourselves and your family healthy and safe. Thank you.